This is Dragon Lewis from the School of Public Health and Preventive Medicine, and welcome to this short video presentation in which we'll try to understand and make sense of data. So in this presentation we'll stick to the third step of the evidence-based clinical practice process, that being trying to make sense of data and specifically dichotomous data. So as mentioned, data comes in both dichotomous and continuous outcomes. So continuous being examples such as height, weight, etc. So on a continuous scale. What we're going to focus on is the dichotomous outcomes. So those outcomes that are reported on a yes-no basis. So we're going to focus on four particular measures of treatment effect. The first being absolute risk reduction, relative risk, as well as number needed to treat. So let's start off by telling a story. Let's say we've got a particular trial. We've got patients with a history of myocardial infarction. We're going to conduct a randomized controlled trial, randomizing them to either having medication with a statin or no medication, and we're trying to identify whether the use of the statin prevents future strokes. So we conduct our trial and we create our classic 2x2 table. Up the top here we've got our stroke, so our outcome. We've got no stroke, and on this side we have got our intervention, so medicated with a statin or no medication, our comparison in this case. Looking at our results, we've got 25 people in the intervention group out of the 100 that have had the outcome of interest, and we've got 65 people in the comparison group out of 100 randomized also having the outcome of interest. So when we calculate the two event rates, we can say that the event rate for the intervention group is 25%, so 25 divided by 100, and the event rate in the comparison group is 65%, so 65 divided by 100. So the first outcome that we'll consider is relative risk. And so relative risk is just the probability of an event in the intervention group occurring divided by the probability of an event in the control group. So as a straightforward division, the first thing that you need to know is if we get a relative risk of 1, it indicates that there's absolutely no difference between the intervention group or the comparison group in terms of their outcomes. So if we use this particular formula, so y being the intervention, x being the control, 25% divided by 65% or 0.25 divided by 0.65 gives us a relative risk of 0.38. So as I mentioned, a relative risk of 1 indicates no benefit. A relative risk less than 1 indicates a benefit for the intervention, and a relative risk above 1 indicates a benefit in the control group or comparison group, or indicates a harmful event if you're comparing an intervention versus a placebo outcome. So the next measure to consider is relative risk reduction. So in the previous slide we were able to calculate relative risk, a relative risk of 0.38, but what does that mean? How do you communicate that? One way to communicate it is through relative risk reduction. So by calculating 1 minus 0.38, we get a relative risk reduction of 0.62 or 62%. So this way we can actually communicate the relative risk of 0.38 as a reduction in the risk of someone having a stroke. So we might phrase it as something along the lines of the risk of having a stroke is reduced by 62% in people who take statins post MI. So it's just exactly the same data, just phrased in a different way, and a way that people find a little bit easier to understand. So the next measure is what we call absolute risk reduction, or you can think of it as risk difference, and it's simply just the difference in outcomes between the two groups, so a subtraction. So in this case we're looking at the event rate in the control group minus the event rate in the intervention group. So keeping the same numbers, 65% of our people in the placebo group had a stroke, minus 25% of those in the statin group, so we get an absolute risk reduction of 40%, or simply a difference of 40% between the number of people having a stroke between the two groups. So again, it's really just another way in which you can communicate the measures of effect. Where I guess relative risk is somewhat limited is in the fact that it doesn't take into account a person's baseline or absolute risk. So everyone's got a different baseline risk of having a stroke. So if you're saying, well, take this statin, your risk of having a stroke is reduced by 62%, it's going to mean different things for different people. So someone who's got a 10% baseline risk of having a stroke due to a number of risk factors, they might actually take it, as opposed to a fit and healthy person who has a baseline risk or an absolute risk of less than 1%, a reduction of 1% down to 0.38%, are they really going to care? So this is where number need to treat comes into effect, because it takes into account the absolute risk. So what it's trying to do is trying to ascertain in whole numbers how many patients you need to treat in order to prevent one additional bad outcome from occurring. And this is where we use risk difference or our absolute risk reduction, however you want to call it. So in this case, it would be 1 divided by 0.4. Please always use the raw value rather than percentages. And that gives us a number needed to treat of 2.5. We can't have half a patient, so we always round up. So in this instance, we've got a number needed to treat of 3. So for every 3 patients, in this hypothetical example, treated with a statin, we can prevent at least one bad additional outcome, that being a stroke, from occurring. The last thing that I'll talk about is interpreting this same data in a graphical format. So here we've got a relative risk, or it could be an odds ratio, really similar, plotted on a graph. So 1 being no difference, as I mentioned, anything less than 1. So in this case, anything less than 1, 0.5 and so on, is beneficial. Anything above 1, so on this plane, is harmful or favours the comparison. So in this aspect, we've got our relative risk, let's say, and our 95% confidence interval plotted. So our relative risk is here. So we might be saying that the relative risk is, let's say, 0.3. The confidence intervals here to here are telling us how certain we are that this relative risk lies between those two values. So 95% confidence interval indicates that we're 95% certain that this value that we've calculated here lies somewhere between this point and that point. Now, the fact that these confidence intervals don't cross over or don't include 1 is also quite significant, no pun intended. The fact that it doesn't include 1 tells us that this result that we're seeing is statistically significant. If the confidence intervals were to include 1, then this would tell us that the result that we're seeing is not statistically significant, because there's a chance that it also includes 1. The fact that the confidence intervals are small tells us that the study is also precise. So obviously, the larger the sample size, the more certain we are that the true value lies between those two extremes. When we compare it, let's say, to the next study, again, it's telling us that it's to the left, so it's favouring the intervention. The confidence intervals don't include the line of no effect, so there's no crossover here. And the confidence intervals are very, very precise. So you could assume quite a large sample size there. If we look at this particular example, the relative risk is telling us that it is potentially harmful. The confidence intervals are quite wide, and the fact that they're crossing over 1 tells us that the outcome is not significant. What it also tells us with the confidence intervals is that it's probably a small sample size. So increasing the sample size would get much more of a truer representation of the result. And then we finish it off with the last example, which is the flip of the first relative risk, where the relative risk is above 1. Confidence intervals are fairly wide, but they don't include 1. So we could safely say that there is a statistically significant difference here between the intervention and the control, indicating that the control or comparison group is more beneficial than the intervention. So that's it. I hope you've enjoyed that and been somewhat entertained and learned something. As always, feel free to drop me an email if you have any questions. Thank you.